Chameleon PTA balloon catheter uniquely combines an 035 high-pressure balloon catheter with supervision technology, an integrated injection modality that provides targeted proximal injection of diagnostic or therapeutic fluids.
I practice in a very busy dialysis access interventional center. We serve well over 2,000 end-stage renal disease patients. And I've had the opportunity to use the Chameleon balloon in easily over 100 cases. The Chameleon catheter comes in your standard balloon sizes, very intuitive to use. It looks the same as any other angioplasty balloon on the market, comes right out of the package. One preps it in the traditional way. You prep the wire port, you can prep the injection port, and then you insert the balloon over the wire. It is so intuitive in how to use this.
Like any vascular surgeon, we sort of have a choice as to which aspects of vascular we want to incorporate in our practice. I'm fortunate to do a bit of everything, but I do an extensive amount of dialysis work. Honestly, it's probably been one of the best modifications to the dialysis access work, in the office especially. It definitely cuts down the time on each procedure, as well as the amount of contrast and radiation that I need.
The ability to image with this Chameleon balloon at points of lesions when you don't have good flow is very important. Imaging in a retrograde fashion under pressure can be problematic if you've just dilated up a area that's severe. Putting contrast under pressure in that area could cause extravasation. So I always like to get my post-angiographic imaging in an antegrade fashion. The Chameleon balloon allows you to do that without having to change out wires or imaging catheters. It can all be done with the same angioplasty balloon. The fact that one can take an additional 3 feet back from your radiation source gives you extra radiation protection. This is something that's important for someone that's doing interventional radiation procedures every day.
The nice thing now is I can stand a little bit further away from the radiation emitter. This was a 57-year-old man, end-stage renal disease. He had multiple failed accesses on his left arm. Ultimately, he has a functioning right brachiobasilic fistula that we've been maintaining. Using a micropuncture, I accessed more proximal on the arm, on the basilic vein, closer to the armpit area. And in a retrograde fashion under ultrasound guidance, advance the micropuncture wire and the sheath, and then after that, go in with an 035 wire in order to introduce the Chameleon PTA balloon. The balloon itself actually has this sort of moderate compliance where it's not too soft and it's not too stiff, but it's just right. So I was happy with the result.
I've been using the Chameleon balloon probably for the last 6 to 8 months, and having a dedicated practice in venous disease, I've applied it onto the venous system, although it's a dedicated balloon mostly for arteriovenous access right now. The Chameleon balloon is a relatively high-pressure balloon, but works very well on curves, and it's pretty semi-compliant. So in areas where there's curves, it tends to work pretty well because of the fact that it's not super high pressure. Having the technology of a diagnostic port or injection port on the device itself will allow you to evaluate your results in a way that you reduce your radiation exposure, you reduce your contrast that you deliver, as well as reduce the time it takes multiple steps to get to the same result.
The Chameleon allows physicians to multitask through the balloon, introducing a new level of procedural efficiency. Chameleon PTA balloon catheter, PTA and injection combined.